Perfect. What I'll do is just go ahead and get started because we do have a fairly short time frame today and plenty to cover, including a couple of very special guests on today's webinar. So yeah, just first of all, I want to say thank you very much to everyone for coming along today. This is sort of national booking webinar that we're running to go over our booking product. We're going to have a chat with Chris, our clinical lead at Accurx, as well as Patrick Denston, who is a practice manager at Alexandra House Surgery. This meeting is going to be recorded, so what we will do is send out a recording afterwards with a few resources to help you get started using booking. Yeah, so we'll send it out to you after the recording today. In terms of what we're going to cover today, it's quite a full agenda. So we are going to be sort of a bit of an intro, and then we're going to be discussing real-world examples of self-book and how these can be used. We'll have a look at Alexandra House Surgery, as I mentioned, and look at the case study that we've done with Patrick's surgery and how they were able to use the booking product to their advantage within surgery. And then we'll move on to the demo itself. So we'll look at how to send a self-book link to a cohort of patients. And just realised a bit of a typo there. It should be first an individual self-book link to patients, and then a self-book link to a cohort of patients, and also how to send this within the inbox when you're dealing with a patient triage request or a FORA response. So we will cover that. We do have some helpers on the webinar as well today, and they are going to be helping with some questions. So if you do have any questions, feel free to pop those into the Q&A box, and a member of the team should be able to get back to you with an answer. If we do have time at the end, I will try and answer any remaining questions live on the call, but we are a little bit time constrained today with a lot to cover in 30 minutes. So hopefully these can be answered during the call itself. We are going to be demoing the product on EMIS today. This is still part of our EMIS monthly webinar week, but just bear in mind the process of completing anything on System 1 will still be the same. So the steps that you will follow, will replicate what we're doing today. Just want to quickly start with the benefits that we have for practices and patients with our booking module. Our booking module is something that we are very proud of. We've built this to address some of the major flaws in the system, and practices just have to set up their appointment book and add appointments in the clinical system, and then they're able to send out links. And there's a few key benefits that practices and patients can get from this. When send out links, patients can book directly into the appointment book. So previously, patients may have been waiting to get through on the phone. So it's just a method of saving time, both for the patients being able to book directly in, but also for the practice staff, saving time instead of maybe answering a queue of calls online. You have the opportunity to crack on some other tasks. Also, greater access for patients. So we tend to find the patients are more engaged with the booking process, and this has helped to reduce DNAs within the practice. And then finally improved staff morale, with staff spending less time on the phone. There is the opportunity to use some of that time on other avenues. You really appreciate that time within practice. It's precious, so hopefully allowing staff to take on some other tasks as well. In terms of the core features of the booking module, there's 3 of these that we're going to be covering today. So we will be looking at the opportunity to invite an individual patient to book an appointment. So that will be done via the ad hoc SMS feature. So this is where you send a booking link to a single patient, It can be a telephone or a face-to-face booking link, and they can book in your practice's appointment book. You can invite a batch of patients to book in. So you don't have to have access to batch messaging module to do this. You can just export your patient list. You can upload this as a CSV file, and you can send a booking link to a cohort of patients that way. And then finally, you can effectively triage patient inbound. So that could be, via response link. It can be, Flurry or within the patient triage reply function, where you can add a booking link, and the patient can book their telephone appointment or their face-to-face appointment via that. So we'll cover these with a demo a bit later in today's webinar, but those are the 3 core features of our booking model. And in terms of real-world examples, we're happy to have Chris, our clinical lead at Accurx, joining us today to help discuss some of the use cases for booking itself.
Nice one, thanks, Jordan. So so like Jordan said, I'm Chris, one of the clinical leads here at Accurx, and I'm also a practicing GP. So I just wanted to talk about a bit of sort of real world examples of how batch and individual self-book are being used. We see both admin and clinical roles across GP practices using the booking functionality, and I'm just going to talk you through a couple of use cases. So I might be describing something really familiar to some of you on the call when I talk about how in a previous practice of mine we used to manage flu invitations, where sort of administrative staff would sort of identify cohorts of patients needing a flu jab, and perhaps using website advertising or newsletters to invite them, or even actually just sit and phone individual patients one by one in this sort of incredibly laborious process, often needing to chase both ways, patients then having to have phone back in to book those appointments, and clogging up the phone lines with other people who are trying to get a flu jab, but also other people who are trying to get appointments and results and whatever else they need to call in for. And quite often you get through to these patients who don't have their calendar in front of them, so they couldn't give you an answer there and then. So creating this sort of back and forth. With batch self-book, for example, you can set up your flu clinic and with the right kind of slot for your flu jabs, and then you could use a CSV file of relevant patients and upload them and invite them all with a message to your specific flu clinic with just a few slots, saving the practice huge amounts of time over that previous process I just spoke through. It's also more convenient for the patient, who can access the link when they get home and choose a time that suits them at their leisure after they finish work and get home for the evening, for example. The other thing we found is you often spend a lot of time trying to get these patients booked in, and in the end they actually just don't want a flu jab. So it's where I want to draw attention to the sort of the box on the left hand side of the screen at the moment called allow decline, and this basically this allows a patient to not only be offered to book an appointment, but lets them decline the appointment type that you're offering, and this is automatically SNOMED coded back to the record with a SNOMED code that you choose. So for flu, for example, it might be that they decline the seasonal influenza vaccine. And this helps the practice sort of accurately record the patient's wishes, but also achievement of targets such as QOF, and also benefits the patient because they aren't asked repeatedly for something that they don't want. And it also negates the need for them to have to call into the practice to let them practice know that they don't want the flu jab. It saves time for staff who can focus on contacting patients who actually want the intervention and perhaps are a bit harder to reach. You can customize the message on this decline flow. It defaults to say something like, if you don't want this appointment, we'll stop sending you invites. Please call us if you change your mind. But you can type in what you like there, and then patients can opt out by choosing I don't want this. Other use cases are things like cervical screening. So we know there's loads of barriers to the uptake of cervical screening, and by using booking you can remove the barrier of someone having to call up, wait, negotiate a convenient time. Again, allowing them to book it themselves and surface all the options available for booking a smear, for example. And there's a few other use cases that I'm sure many of you could think of, but things like chronic disease reviews, among others, could be used for this. Individual compose, which is done from your compose screen. When you go and send a message to an individual patient, you can add a booking link and a couple of links, choosing whichever slot type you want to book the patient for. And so for any of the batch uses like flu or smears, for example, you can ad hoc invite patients when you need to, instead of sort of leaving when you get that pop-up in the corner saying this patient's overdue their screening, for example. You could also just, rather than saying go and book it in with reception, you could send them a link and they can go home and book it in when they like. Another thing that we've seen being used is for blood tests. So during a consultation, you might decide a patient needs to have some blood tests, and you can send them a booking link there and there if you've got the slot set up for a blood test at the practice, allowing the patient to just go home and book the appointment at their convenience without having to queue at the reception or call back in later. And even when a patient isn't there, so you're going through your results perhaps, and some of the tasks you might have previously sent to be like, I'll get this patient, if that's your workflow, maybe messaging reception and saying, can you get this patient to book in, or texting the patient with just an instruction to book in a follow-up appointment or a follow-up blood test. The reviewing clinician can now either task an admin member or actually do it themselves and just send a booking link saying, I've looked through your blood tests, X, Y, and Z, they might need a repeat in 3 weeks, 4 weeks, here's a link, can you please book an appointment? So those are a couple of the use cases and examples that we see being used in the real world to save time and be real convenient for patients.
Amazing. Thanks so much for that, Chris. Really good insight into some of the use cases that you can use both for batch self-book as well as individual self-book within that composed screen there. Just moving on to look at Alexander House Surgery, and we've actually have Patrick Denston, practice manager at the surgery, joining us today. Hi there, Patrick. How are you?
Hi, thanks for inviting me today. Really appreciate it. Yeah, very well. Happy to talk about Accurx and self-book. It's really changed our practice. We started using it just under 12 months ago, and we started using it for flu and specifically follow-up sort of flu appointments. And what it allows you to do, one of the benefits that hasn't been mentioned, is you can stagger the messages, and you can also send them out of hours. So you can delay the message going out, so it doesn't clog your phone lines up with people ringing up. They don't get the message until the surgery's closed. Then if it is still really important to them, they can call up the following day or the following week. And that made a huge difference. I now don't have to ask permission from my entire reception team when I want to send out an invite, or the admin team don't have to give warnings, because actually the reception team don't notice anymore that these recalls are going out. And since September last year, we've expanded that out into many other areas. So using the Florey feature first for an NHS health check, and then as the response comes in, sending out the booking link for blood tests, so that actually the time in practice is quite minimal, because you've got all the information in beforehand, and it actually can all be done by a non-clinician until they come in for the blood test, which is super useful. We've used it for chronic disease management, and it works quite well in partnership with Arden Searches, that they actually make templates for the CSV files now. That means that I had to go actually while Chris was talking to see whether I could get all my flu invites set to go in the 4 minutes that he was talking, and I could. I haven't sent them just in case I've made a mistake, but it's a very fast process, and I think that's the bit that's really important. And over the years, the mass messaging from Accurx has been simplified so much that it doesn't need to be a manager anymore sending out these big messages. You can teach somebody quite easily to use the search functionality and then send it out. The other thing that I don't think we had a screenshot for is that with the bulk mass messaging, it also tells you how many available appointments you've got. So you can't invite 700 people to 4 appointments. It'll flag up a warning and say, well, hold up a second, you haven't got capacity for that, which is super useful, because then you can actually be reactive on spaces that you have got. You can change your appointment books to match your actual needs for your patients. And it allows you to, not necessarily with the month of birth recall systems for the chronic condition, sending everything out at the start of the month, you can stagger it over the month, but you can also, if say, for example, last week our diabetes nurse was on annual leave for 2 weeks, we just didn't send any diabetes checkup appointments out in that period. But it's very easy for an administrator to know that, because they can see who's on leave and what's available over the coming month or 2 months on your booking system, to send out batch messages to match that. And then on the flip side, you can have a look and see, well, I have actually got a load of spare appointments. Let's do a bit of a drive on shingles, or let's do a drive on pneumo, or we've got a bit of spare capacity. Let's use it for something useful to our patients, with it having minimal impact on the administrative team.
Amazing. It sounds like a whole host of benefits that you've managed to get from using the booking module. And if you don't mind me asking, Patrick, how have you found the patient engagement side of things has been with the links once they've been sent out?
It's brilliant. I mean, the uptake is fantastic. I think, like you said earlier, if people don't don't want to engage or they don't want to come and have a flu jab, the option to decline is also really useful, because you're chasing people, and it records that you've invited them. So you can see that they've had 3 invites. You can see that they've had an SMS invite. You can see that we've tried calling, but then you can also, it gives you the failed message list. So you know if their mobile number's not working. So there's no point in texting them 20 times. You then have to call them and write to them. And it makes that process a lot more efficient as well. And patients love the simplicity of it. And it's quite exciting to sit there watching a flu clinic fill up with nobody ringing up. It's quite good. If you send out 1,000 invites and you just see your clinic populating at a similar rate, it's superb.
Amazing. Great to hear, both patient and the practice side. You'd really positive experience there. And yeah, thank you again both to Patrick and to Chris for giving us some very good insight today. Just want to quickly shout out a couple of things. So in terms of what's coming soon with our booking module, we're currently working on the ability for patients to select a specific clinician when booking an appointment via the patient portal. So allowing patients to continue their care with their preferred clinician. And then a point on booking in general. So is it free to use? So, booking features are procured centrally until December this year. So practices just need to pay for SMS costs if not covered by their ICB. If you're unsure who does cover your SMS costs, please do just check with your ICB and they'll be able to give you the information on that. But keen to crack on with a quick demo of booking and some of the core features that I touched on a bit earlier. So what I'm going to do is just come out of the slides, and I have EMIS open here. So I already have the test patient for myself loaded up, but if I wanted to load them up, I could just search and load up my test patient there. But we can start with individual self-book first. It's mentioned by Chris there, it was done within the compose screen. So that's within your Accurx toolbar. Just on the very left-hand side, we have this message icon here. And this is where you'll be able to just click this up and compose a message to the patient. So if we have a look at this just now, we can just see the patient's been loaded up with their details. We have the NHS number, the date of birth for the patient, and the gender, with this message going out to the patient's mobile phone number. We can use a template when sending out the message to the patient. So you may have some templates that you've created within practice, save on those admin hours of typing up a new message every time. So you may wish to use a template. However, you can also send a message out via free text. So you can see just typing in the box, and you will also be able to see the character count with our new fragment counter also there. So this is designed by our team to help practices manage their fragment use as much as possible. So you'll see the character count, and if you hover over the fragment counter, and if you were to click this, it will take you to our user guide about fragment counters. But if I was going to type a message to a patient and send an individual self-book message, I could say something like so I would like you to book an appointment, and I could then use this booking link just at the bottom here. So click where it says booking link, and this will give me the opportunity to add a self-book link to our message. So when sending an individual self-book message, you can choose between a telephone self-book link or a face-to-face link. You'll see when sending a telephone link, it will allow the patient to select an AM or PM window for a phone call. And if it's a face-to-face link, the patient will be able to select an exact appointment time. After you've selected your appointment type, you can just select the slot type that you would like to send this out for. You'll see we have 5 here, so it's pretty easy to select the one that we want. But another recent upgrade is that if you have, a larger list of slot types there, you will be able to search by the slot type that you want to select. So if I was looking for GP routine telephone, I can start searching that, and that will give me the option. Especially with those longer lists, it stops that kind of longer process of scrolling to find the slot type that you're looking for. I will select the one routine slot type today, and I can just add this booking link. So we'll see that this booking link comes through, and it's going to also generate a link for the patient to click on. The link itself is going to be available for up to 7 days. That is one-time use for the patient. So once they use this, they won't be able to continue booking appointments within that 7-day window. But we can, click send now, and we can see how that loads up for the patient and go through the flow of a patient booking their appointment. I do have this currently set as save to record when I'm sending this message. If you choose that you don't want to save this to record, it's just a matter of unticking the box or reticking if you do want it to save to record. But I can hit the send now button, and we'll see how this comes through to the patient. So the patient has received this, and we can see it's currently saving to the record. And this is how it would look when the patient, is looking at this on their phone, for example. And when the patient clicks on the link, they'll be asked to first just verify themselves using their date of birth. So I will do this here. I can confirm my date of birth, and then the patient can follow through to say they'd like to book their appointment. If you do have multiple sites, it will just ask which site, but we just select our Accurx office today. And the patient will then be able to select, first of all, what day they would like to book their appointment on. So if I was in a perfect world and wanted to book my appointment for tomorrow, and I wanted something around lunchtime, then I can look and say, yep, I'm keen for an appointment tomorrow at 12:10. And I can just scroll down and just confirm that, and it will take me to the review page. So the appointments that the patient is able to see are scraped from your appointment diary within practice. So it's only appointments that you will have available. These appointments are also embargoed as well. So, when a patient books in for one of these appointments, if there are no more appointments available at that time, it won't show as an option for the patient. So you're not going to have, double bookings and stuff like that as well. I can just confirm this appointment if I'm happy with that. And this is just confirming in the diary. And great, we've just got confirmation that our appointment has been booked, as well as a fairly recent development as well. The patients are also able to add the booking into their calendar. So just something that's really nice and convenient for patients. They can click add to calendar, and they can, add this to any calendars that they have synced with their device. Hopefully it just allows patients to keep organized, and hopefully reduce some DNAs for the practice as well. And perhaps if a patient just forgets about their appointment. But that is sending an individual self-book via the compose screen. And what we'll do now is just have a look at sending a batch self-book. So that would be done via the toolbar. I'm just going to click on my initials, and I'm going to go to batch messaging here. What I could do is just click send a batch message, and we can choose our batch type. So we're looking at sending a batch self-book today. So I can select I want to send a batch self-book. And you can first of all select the slot type that you want to send this for. So you'll notice when I click the drop-down menu for each slot type, it is, not only telling me the name of the slot type, but also how many appointments are available for each slot type. So we can see there's no appointments available for diabetic slot type, but we have over 1,000 for one routine slot type there. So just worth bearing in mind, you may have to add more appointments into the diary if you're particularly low on any of these slot types. For example, if I had a patient list of 2,000, I wouldn't be able to currently send this to any of my slot types, but for example, not the one routine slot type as well. But we've got much smaller by our demo today. So I will just choose that one routine slot type, and I can also use a template. So you can select any template that you want from the list below. and these will, fill out the body of the message. So if I wanted to do a diabetes review, this would come up with the preloaded text, and it's similar to sending a individual self-book link. This link would auto-generate at the bottom. You can see the character count as well at the bottom, so it is limited to 306 characters in total, and that includes text both in the introduction and also within the link itself there, as well as the save invite message to record function. So that's currently ticked, meaning it's going to save to record, but I can untick that if I would like to. And also that the SNOMED code is automatically loaded up. So we can see that this SNOMED code would be saved to either the consultation in AMIS or the journal if you are using System 1. And as covered by Patrick and Chris earlier, the decline settings, they have option to here. You can toggle this to on if you would like to give the patient the option to decline the invitation, and that lets you control follow-ups, and you're also able to choose the SNOMED code for if the patient does decline. So if I wanted to search by diabetes and review, I could select that there. And then the next stage would be just uploading my patient list. So there are instructions for doing this both in EMIS and System 1. So when you have your patient list, you just upload it here in CSV format. And I'll just upload our batch demo that we have today. And this will quickly fetch demographics for that. And we can see the outcome of that for our patient list. So you can actually see that in total there are 8 patients on our patient list. 2 can be sent the particular batch self-book invitation. 6 patients aren't able to receive it if we click the drop-down menu. You can see it's just because we don't actually have phone numbers saved for these patients. Before these, you can download the list and update those patients' contact preferences. It most likely be the case that you will have the vast majority of patients that can receive it, and then you perhaps say a few who are not able to receive it, but you can easily download the list and just update the contact preferences for those patients. And if we're happy with that, we can continue. We can review the message itself, and we can then choose to send the message. So this has been sent off. It may load up below, but essentially, yep, there's going to be a table here where we can see these batch messages that have been sent out. So we can see that mine is sending just now, but if we have a look at another self-book message that's been sent, we can view details, and we can find out some further information about that. Bit conscious of time, so I'm just going to go into the inbox and show the final core feature of the booking functionality here. So I'm opening up my Accurx inbox, and I'm just going to go into one of the things within our inbox, and I'll show you where you can follow up with a self-book message there. So we can select this particular request, and it's very similar to when you're within the compose screen in terms of sending the batch message. What you'd want to do is just choose that you want to reply to the patient, and when this loads up, there we go. So it would be in the bottom right-hand corner where you can select the booking link. You'll once again be able to choose telephone, face-to-face, as well as the slot type there. And the flow for doing that will mirror what we covered earlier in terms of the steps of patient inputting date of birth and then following those further steps. Aware that just like that, we've hit 2:30 already. I do want to, I'll just stop sharing my screen just now actually. But yeah, I want to say thank you to Patrick and Chris for coming along today. It was really, really good to hear, that in real world how this is used and how it's helping practices, and also to everyone for coming along today. So we will follow up with the recording of today's session, with some additional resources to help you get started or to just support you as you continue using booking. But yeah, thank you.